everybody. This is Dr. Sattler here again with Creating Future Nurses. And today I have with me Miss Deborah Stroud. Miss Stroud is a nurse with Life Care of Medina. So thank you for joining us today, Miss Stroud. How are you doing?
I'm fine, thank you. Thank you for having me.
Wonderful. So why don't you start out by telling us a little bit about yourself and your role with Life Care of Medina?
I am an LPN at Life Care Center Medina. I've been there for 13 years. I started out there as an STNA for 4 years, and then I've been a nurse for the last 9 years. So I've done STNA and LPN, and many years back I was also working in the kitchen. So I've had a couple of different roles there, but I've really settled into the LPN role as my calling.
Okay, okay. So why did you make the decision? So you say you were in the kitchen and then you were working as an STNA.
Yeah. When I went to
So why did you make? Oh, go ahead. I'm
when I
sorry.
went to STNA, it was with the intention of becoming a nurse. At that time, you needed to have your STNA certification to start the LPN program. So it was a start to that goal.
Oh, okay. So it was a requirement at that time.
Yeah,
Okay, okay. Do you think that it's better to start out as an STNA when you look back on it? Do you think it had any benefit for you?
absolutely. I think it's like building your tower. You got to start with base foundation information and guidance and knowledge. And I think that that's really the base of the job.
Hmm. So now, I'm not sure. Is it still a requirement or no?
I I am not sure. I think that you are
Okay,
supposed to have your certification, but not necessarily work experience.
okay, okay. Yeah. So someone that maybe never worked as a STNA, what advice might you have for them going into nursing?
Well, I think it's very helpful to learn some hands on care. And some of your clinicals in nursing is going to give you some basic hands on care for patient care. But then I think that you should take every opportunity to build on that because it'll create a more whole you to be able to contribute to your patient.
Okay. So why did you decide to go into nursing?
Um,
What made the change?
I wanted more interaction with the residents I was taking care of when I was in the kitchen. It was really interaction from a distance, a little bit of a hi in the hallways as you go by and knowing their food preferences, but it wasn't very personal. I wanted to get more personal with that environment.
Okay. And how do you like it?
I like it very much. When I first when I first became an LPN at the nursing home, a nurse I had worked with who had been a nurse for 40 years said that she really thought she would specialize somewhere and that she would recommend to me to specialize somewhere. She didn't expect to end up in geriatrics. But just because somebody gave me that advice doesn't mean that it's good advice because I've really enjoyed geriatrics. Um, I get a very personal relationship with my residents. It's not somebody I just take care of for 2, 3, 4 days. I've been taking care of some of these people for 4 or 5 years, and it really helps me catch when something's starting to go wrong to know them so well.
Hmm.
So,
So this is long-term care, correct?
correct.
So give us what the day in the life of a long-term care nurse may look like.
So when I start a shift, I'm getting a report from the night shift nurse leaving. And that's a 20, 30-minute process for us to go through each patient, what happened on their shift with them, any concerns, what might have happened yesterday if I wasn't there, what they got in report from the previous nurse. We'll go through each of anywhere from 20 to 30 patients on our assignment. And then we'll go to the medication cart and we'll check every narcotic that's in the drawer to verify that everything that should be there is there. So it's a count off. That takes about a half hour. And then I start a medication pass. For me, it's the morning med pass. That takes anywhere from an hour and a half to 2.5 hours. After a medication pass, I'll do some charting for the assessments I just performed while I was doing a medication pass. On my to-do list for the day is some treatments. I may get to those right after the morning med pass, or I might not get to those till the afternoon. Time flies, and then you're ready to start your noon med pass in the middle of the day between 11 and 11:30. And that takes about an hour. And then I'll go take a break and a lunch. When I get back, it's kind of paperwork.
So you do get a break.
Absolutely. I usually take a break somewhere before I start a med pass and then midday. Afternoon is usually kind of paperwork time. There's a lot more paperwork involved than I realized when I was a nursing student. Clinicals was, all about direct care and the medications, but there was a lot more paperwork to it involved. I realized when I got on the job, managing faxes that came back from the doctor, their labs getting reported to them, and then you taking off an order that resulted from that lab, calling other doctors' offices to incorporate more needs and cares for your patients. Um, there might be a psychiatrist in the building that day that's giving me orders. There might be an eye doctor in the building that day that's giving me orders. So orders are paperwork time in the afternoon. And then we do a medication pass right before dinner, checking blood sugars before each meal. You could have one or two people who are needing a blood sugar check. You could have 6 or 7 people who are needing a blood sugar check. So it's a clock watching game all day long. Um, a little bit more paperwork. Maybe there was an incident in between. And then I start reporting off at 6 o'clock.
Okay. So you said something that made me think about, was there a reality shock for you going from nursing student to actual nurse?
Um, I think that clinicals and classes prepared me. It wasn't too much of a shock. There was more paperwork than I expected. I've had a great opportunity to have um, preceptors, instructors, and coworkers along the way that I'm more than willing to utilize. So in my environment, there's always another nurse close by that I can ask for guidance, especially when I was new. I was worried about how fast is it going to take me to get used to this world. Will I figure it out in 2 or 3 weeks? And it was a little bit of a disappointment when the first nurse told me, honey, you're not going to be comfortable for 6 or 7 months. And I was like, no, I don't believe that. But it was true. Because,
Mm-hmm.
sometimes when I'm training someone now, I'll hear someone out of frustration say, well, I wasn't told that in training. Well, I need people to realize I can't tell you everything in training. There's a lot of information to come at you. You're going to learn as you go, but you're going to learn.
Mm-hmm. Right. So, as a nursing instructor, I'm always trying to get my students to understand about how to prioritize and prioritizing patient care. How do you prioritize your day?
Um, so on my worksheet, and everybody's worksheet is going to become something custom. But on my worksheet at the bottom of everybody's name and needs, my to-do list for the day is chart, do my treatments, do my respiratory assessments, which are new to COVID. A lot of things are new to COVID. And do my other daily assessments that come up due. So that's a
Mm-hmm.
4-piece checklist. Besides, of course, your medications are the top priority. Um,
Mm-hmm.
so medications and assessments and charting what you did. There's
Mm-hmm.
going to be things that came
And then
up.
obviously that changes depending on what's going on in the day.
Right.
Someone has a fall or different things
Someone
happen,
could
right?
fall on you, and then all of a sudden, that's your priority. You gotta make sure that somebody
Right.
who might be hurt is not hurt. If they are, find out how badly they're hurt and what needs done first to get them safe again.
Mm-hmm. What do you like best about working in long-term care?
Um, the resident interaction. I feel like all of a sudden I have 12 more grandmothers and 5 more uncles. Um, for me, it's very rewarding.
Yeah, yeah, yeah. So, what do you believe is the most important quality for any nurse to possess, whether they're in long term care, critical care, no matter where they are, what field they might be in?
That you're there
What do you
to
think is?
that you're there to take care of that patient. It's a business, so there's a lot of bottom lines for management and money. There's a lot of ways to get reimbursement and get paid for what you're doing, but all of that needs patients and residents. And the primary concern, the most important quality is that you're there to take care of them, that you want to take care of them, that you care about them, and then it all stems from there. If you don't want to do it, go do something else.
Mm-mm. Yeah, yeah. So, on the other side of that, what have you seen or what do you believe makes a poor nurse?
A poor nurse, um,
Hmm.
someone who's told by their aide that their resident seems off today. Something seems wrong. They're sad. They're moving slower. And then when I see that nurse say, okay, and walks away and blows that information off, um, lets the next nurse hear about the report and let them take care of it, or think it's not something important. Um, that's what I see as a poor nurse.
Yeah, yeah. And why do you say that?
Because I don't feel like they're taking care of the patient. I feel like now that you know something needs to be looked at, if you don't go look at it, why are you there?
Hmm. Exactly. Well, that's good. So, what is the best advice you could offer someone that might be in nursing school or getting ready to graduate nursing school?
So for me in nursing school, studying was something I had to readjust from high school. That may not have been your last stop in school. That may have been years ago, but that certainly develops somebody's initial study habits, high school. And college is different, and nursing school is more different. Um, I'm not a social butterfly, but I did find that putting myself out there in some small study groups was really beneficial. I'd be in a group, we'd be talking through a disorder that I thought I had a good handle on. And all of a sudden, I realized because of peers helping me through it that I didn't have a good handle on something. And another point of view helped me see the bigger picture. And once you commit to somebody that you're going to be there with them to do some studying, it kind of holds you accountable and makes you go do it. So a small study group is really recommended, but in addition to that, you need to have private study time too, more than you think. I mean, if you're going to go set aside 30, 40 minutes in between a class or at the end of a class, that's not really enough. Um, it takes 2, 3, 4 hours at a time, 3, 4, 5 times a week to get in the studying that's really going to be needed.
A lot of times I have students that say, oh, it's slow at work. I work night shift. It's slow at work. And I can just do my studying at that time. What's your thoughts on that?
You can get a very, very small benefit from that kind of studying. If you have some note cards that you're just working on some memorization, repetitive look back on those might help for those small little square moments. But if you're trying to learn a new disorder or, take something in and really own it and learn it, you need to set aside that time. I started using for a different environment and whatever I could find to stimulate me. I started going to 3 or 4 different local libraries to their quiet study room and use those environments to be, I can get up and walk around, I could be alone, I could have some quiet time, and I use that for my study time in the school library at the college. But
Mm-hmm.
no,
Mm-hmm.
work is too easy to have a distraction. Home is too easy to have a distraction. And you're going to be mid learning something, and all of a sudden you didn't learn that last line. That's the most important. And that's not the best recommendation.
Mm-hmm. Mm-hmm. Um, is there anything else maybe that we didn't talk about that you think might be helpful for current nursing students or new graduates to know?
Um, I think a new graduate needs to realize that you may have heard starting out on night shift is what your expectation is going to be because that's where the more need is. I remember hearing that when I was a nursing graduate and I was spooked by it because I don't like nights. But if you don't like nights, expect to put your time in because it's a slower pace and you're going to want a slower pace to learn a new world. It's going to take a little while, maybe a couple of years, to get your foot in the door and start getting comfortable with this new world. Um, yeah, embrace it, expect it. You might have to do nights somewhere first, but it's going to help your learning process
Mm-hmm.
because when you get too much thrown at you too fast, it's not all going to sink in. So you want to take baby
Mm-hmm.
steps. And I think night shift is a good
Yeah.
start for that. When you're still in school, another thought that I would have is take the time to prepare for a test, not just studying, but get some sleep before the test, get some protein in you before you go take that test.
Mm-hmm.
Make it a priority that this is my main focus right now.
Mm-hmm. So I'd like to give, I'm trying to give, nursing students the different avenues of what's available to them as a nurse. So someone that may not know what area they want to go in, what would you suggest to them how they could kind of figure out, is long-term care something for me, or, do I want to go a different route?
I remember in nursing school starting to get an idea of how many different kinds of positions are out there for nursing. So throughout nursing school, I'd have a separate little spot where I would jot down those thoughts like, oh, surgical nurse sounds kind of neat. Oh, dermatologist office sounds kind of neat. As you start learning about the different roles in school, um, use that as your base for thoughts. But every aspect of healthcare, whether it be wound care, dermatology, um, kidneys, diabetes, every single area has a few separate positions for nurses. So you could do 9 to 5 doctor's offices if that's what you like for your schedule and your home life. There is emergency care, hospital care. I mean, there's quite a variety out there. I think just looking through some want ads might help you start thinking about the other positions out there. I know some things seem to not become available until you got your foot in a door somewhere, but ask questions of other nurses. What other positions have you thought about over the years? I thought about doing maternity ward. That sounds great, seeing a baby born all the time. But I kind of quickly shied away from that because I was overwhelmed with the responsibility of what if something went wrong. And it's not a long-term interaction with those patients. So that was something that was important to me and helped me with my decisions.
Well, I think you're absolutely great nurse in your field.
Thank you,
So,
Donna.
well, thank you so much for joining us today, Miss Stroud. And thank you guys for watching. And if you enjoyed this video and you like to see more like it, then please consider subscribing to my YouTube channel. Thank you and have a great day.